In 1992, when archaeologists cracked open the tomb of Pharaoh Tutankhamun, they found gold, jewels, weapons forged for a king meant to rule the afterlife. And tucked deliberately among those riches, they found seeds, not scattered, placed, deliberately chosen. Historical records suggest those royal physicians believed these seeds were valuable enough to carry a king into the next world. 6 centuries later, the greatest physician in Islamic history, Ibn Sina, whose textbooks shaped European medicine for 500 years, documented that these same seeds could pull a person back from the edge, from the exhaustion that hollows you out, from the dread that won't let you breathe, from despair so deep it looks like illness. Ancient texts describe armies carrying them across the Silk Road. Physicians from Egypt to Persia to China document them for the same purpose, a mind overtaken by fear. Then, quietly, they disappeared from Western medicine. Not from the earth, from your doctor's office, from the pharmacy, from the conversation entirely. And in the space they left behind, a $500 billion pharmaceutical industry built its answer to anxiety, one that requires a prescription, generates dependency, and cannot be grown in the ground. For over 3,000 years, these seeds were not folklore. They were the first line of defense. Ancient Egyptian physicians, Persian scholars, Chinese herbalists, West African healers. Across every continent, across every century, historical records show independent cultures arriving at the same seeds for the same purpose, a mind overtaken by fear. Then, in the mid-20th century, a different kind of medicine took over. Laboratories began producing synthetic molecules, precise, patentable, and enormously profitable. Benzodiazepines arrived first, then SSRIs. The pharmaceutical industry didn't erase ancient seed medicine through a dramatic bam. They did something quieter and more effective. They stopped funding the research, stopped training doctors in it, stopped allowing medical claims to be made about it. In the European Union, the anxiolytic properties of these seeds were placed on an official regulatory on-hold list, where they have sat, frozen, for over a decade.
And while the system decided these seeds didn't deserve investigation, the drugs it chose instead began leaving a trail. Today, over 92 million benzodiazepine prescriptions are written in the United States every year. Withdrawal from these drugs can be fatal. Cognitive damage is documented. Dependency develops within weeks. Meanwhile, antidepressants, prescribed to 1 in 8 American adults, frequently cause the emotional numbness, sexual dysfunction, and weight gain that drive patients to stop taking them, often unsafely. The global anxiety treatment market is now worth over $500 billion annually. The seeds that worked for 3 millennia are classified as food supplements. Something was buried, and people are paying for it with their health and with their lives. Welcome to Ancient Healing Harvest Secrets, where we follow the research the system stopped funding. Now, let's talk about the seed at the center of this story, Nigella sativa, known across the ancient world simply as black seed, and why, after 3,000 years of documented use, your doctor has almost certainly never mentioned it. The story of Nigella sativa doesn't begin with a scientist. It begins with a burial. Around 1325 BCE, Egyptian royal physicians made a deliberate choice. Among the objects deemed worthy of a god king's eternity, historical records show they placed small, black, angular seeds. Ancient Egyptian texts described them as a panacea, not a treatment for one condition, a treatment for imbalance itself. And in the Egyptian understanding of the body, anxiety, despair, and mental fragility were not problems of the mind. They were problems of the whole person. These seeds addressed the whole person. Then the seeds traveled. Through trade routes and conquests and generations of healers passing knowledge to apprentices, Nigella sativa moved from the Nile into the Arabic world. There it was renamed al-Haba al-Sauda, the blessed seed, and elevated to new sacred status. Islamic physicians declared it a remedy for everything except death. That was not poetry.
It was a clinical instruction carried in every physician's handbook across the medieval Islamic world.
In the 11th century, Ibn Sina, whose encyclopedia The Canon of Medicine remained a standard medical text in Europe for 500 years, documented these seeds specifically for what we would now recognize as anxiety and depression. He recorded that they could restore energy and pull patients back from states of despondency so deep they had become debilitating. This was not a footnote. It was a primary recommendation from the most cited physician in history. Meanwhile, on the other side of the world, a parallel discovery was being made. In East Asia, healers were documenting the seeds of Ziziphus jujuba, what TCM practitioners called Xuanzao Ren, the sour jujube seed. The earliest records appear in the Shennong Bencao Jing, China's classic of herbal medicine, written over 2,000 years ago. That text placed these seeds in the highest tier of medicine, reserved for substances safe for long-term use, capable of promoting not just recovery, but emotional stability. Chinese physicians prescribed Xuanzao Ren for what they described as heart fire, the racing pulse, the sleeplessness, the dread that sits in the chest and will not leave. The formula they developed, Xuanzao Ren Tang, remains in clinical use across Asia today. And further still, in West Africa, healers were working with a third seed entirely, Aframomum melegueta, known in the spice trade as grains of paradise. Where Egyptian and Persian physicians recorded their knowledge in encyclopedias, West African healers preserved it through practice, generations of empirical observation passed directly from healer to patient. Medieval European traders who encountered these seeds described their effects as remarkable. By the 15th century, they had reached European apothecary shelves, prized, expensive, then quietly faded as synthetic chemistry arrived and ancient knowledge stopped being profitable. 3 seeds, 3 continents, 3 completely independent traditions arriving at the same category of medicine across 3,000 years, without ever communicating with each other. That is not a coincidence. That is a pattern worth paying attention to. Here is what researchers found when they finally looked closely. Your brain has a natural off switch for anxiety. It's a chemical called GABA. Think of it as your nervous system's built-in calm signal. When GABA is working, your brain gets the message. You are safe. You can stop bracing. But under chronic stress, your brain stops producing enough of it. The calm signal fades. The alarm stays on. That constant low-grade alarm, that is anxiety. The primary active compound in Nigella sativa is called thymoquinone, and what it does is remarkable. It doesn't sedate you. It doesn't knock the alarm off by force. Research suggests it helps your brain rebuild its own calm signal by converting the very chemical causing overactivation into GABA itself, recycling the problem into the solution. Now, compare that to what your doctor is actually prescribing. Benzodiazepines, drugs like Xanax and Valium, force your brain's calm receptors open artificially. It works fast, but your brain notices and starts reducing the number of available receptors, so you need more drug just to feel the same effect. That's tolerance, then dependency, and if you try to stop, withdrawal can be fatal. Studies suggest black seed reduces anxiety without that receptor damage, and may even help repair the damage benzodiazepines cause. SSRIs, drugs like Prozac and Zoloft, target only one chemical pathway. They take weeks to begin working, they frequently cause sexual dysfunction, emotional numbness, and weight gain severe enough that many patients stop taking them. The black seed works on a similar timeline, but while it's reducing anxiety, research indicates it's also helping rebuild the brain's structural health from the inside. 2 very different approaches. One the system funds, one it doesn't. This is not alternative medicine happening in someone's backyard. This is clinical medicine happening right now in licensed practices and government-regulated systems on the other side of the world. In China, Ziziphus jujuba seed formula has never left the clinic. Licensed physicians prescribe it daily for anxiety, insomnia, and stress-related disorders. Patients buy it over the counter, the way an American walks into a pharmacy for ibuprofen. The formula has been in continuous, documented clinical use for over 2,000 years.
and it is currently one of the most studied botanical compounds in Asian psychiatric research. In Australia, the government's own medicines regulator, the Therapeutic Goods Administration, has formally approved practitioner-grade supplements containing Ziziphus jujuba for mild anxiety and nervous tension, not as a food, not as a wellness product, as a regulated therapeutic intervention prescribed by licensed practitioners approved by the state. In the Islamic world, from North Africa to South Asia, Nigella sativa has remained a medically respected compound for 14 centuries without interruption. Sold in pharmacies, studied in universities, its standing never challenged because it was never handed to a system that required patents before it accepted proof. In the United States, your doctor has almost certainly never mentioned any of these seeds. Not because they don't work, not because they're dangerous, but because in America, a substance cannot be officially recommended as a treatment unless a pharmaceutical company has funded the clinical trials. Trials that only make financial sense if the result can be patented and sold exclusively. You cannot patent a seed, so the research stays in journals, the doctors stay uninformed, and the patients stay on medications that carry black box warnings, while the rest of the world uses what the research already supports. There was no dramatic moment, no congressional hearing, no scientist declaring these seeds dangerous. What happened was quieter and more final. In 1994, the United States Congress passed the Dietary Supplement Health and Education Act. On the surface, it protected natural health products, but buried inside was a clause that would effectively silence thousands of years of botanical medicine. Supplement manufacturers could sell black seed oil. They could sell jujube seed extract, but they could not tell a customer, on a label, in any official capacity, that it might help their anxiety, that it had been used for exactly that purpose for 3,000 years, that researchers had identified the precise molecular mechanism explaining why.
The moment a manufacturer made that claim, they crossed into pharmaceutical territory, and pharmaceutical territory has its own rules. FDA drug approval costs hundreds of millions of dollars and takes over a decade. Those costs only make sense if the company funding them can patent the result. You cannot patent a seed that has existed for millennia. So no company funded the trials. No trials meant no approval. No approval meant no medical claims. The seeds were legal, but silenced. Across the Atlantic, the European Food Safety Authority launched a formal evaluation of thousands of botanical health claims, including the anxiety properties of Nigella sativa and Ziziphus jujuba. The evaluations began. Then, quietly, these seeds were placed on an official on-hold list, neither approved nor rejected, simply frozen. That list has existed for over a decade. No overdose deaths, no addiction cases, no documented harm across 3,000 years of use. The seeds didn't fail any test. They were never allowed to take one. Ask yourself a simple question. Who benefits when a seed that has calmed anxiety for 3,000 years, one that grows in the ground, cannot be owned and cannot be patented, is legally prevented from being called medicine? Follow the money. The global anxiety drug market is worth over $500 billion annually. Not wellness products, not supplements, prescription drugs, patented, controlled, and priced at whatever the market will bear. Pfizer, Eli Lilly, Roche. These companies did not build their empires by finding the most effective treatment. They built them by finding the most ownable one. And every one of them faces the same problem with these three seeds. You cannot own them. Anyone can grow them. A bottle of black seed oil costs a few dollars. A month of Zoloft without insurance costs over $300. Here is the detail that should stop you cold. Pharmaceutical companies are currently spending billions developing a synthetic drug that blocks the enzyme destroying your brain's natural calm chemical. That drug, if approved, will be patentable, expensive, prescription only, worth billions to its manufacturer. Research published in 2025 confirmed that Aframomum melegueta, a seed West African healers have used for centuries, already does this, naturally, without a patent, without a prescription. It is sitting on a supplement shelf right now with a label that legally cannot tell you what it does. This is not incompetence. This is a system optimized for profit, not for patients. The most profitable treatment is never a cure. It is a management tool, something taken indefinitely, something the body builds tolerance to, something that generates a lifelong customer. A seed that rebalances your brain's own chemistry cannot do that, which is precisely why it was never allowed to compete. While that debate played out in regulatory meeting rooms, real people were paying the price. Anxiety disorders currently affect 40 million adults in the United States, the most common mental health condition in the country. And the system's answer has been consistent for decades. Here is a prescription, come back when it stops working. Over 92 million benzodiazepine prescriptions are written in America every year for a class of drug the medical establishment has known since the 1980s produces physical dependency within weeks. A class of drug whose withdrawal can trigger seizures severe enough to kill. Not in rare cases. Documented. Warned about on the label. Known. Benzodiazepine-involved overdose deaths in the United States now exceed 12,000 per year. That number has climbed almost every year for 2 decades. And those are only the deaths recorded as direct overdoses. They do not count accidents caused by sedation. They do not count suicides following years of failed withdrawal. They do not count the people whose memory eroded, whose ability to think clearly never returned, because they were handed a prescription nobody told them to stop taking. More than 12,000 deaths, every year, for decades. The entire time, black seed was sitting in herb shops. Jujube seed formula was being prescribed in Chinese clinics. Grains of paradise were growing in West African soil. Their mechanism for protecting your brain's natural calm chemistry already understood by the people who had used them for generations. We did not lack a solution. We lacked a system willing to recognize one it couldn't profit from. The anxiety crisis is not a mystery medicine is still working to solve. It is the predictable result of building a mental health system around treatments that create the customers they claim to treat. Eventually, some researchers decided to look anyway. A clinical study published in the Journal of Psychopharmacology, indexed on the National Institutes of Health's own database, examined what Nigella sativa extract actually does to the human brain over time. Real patients, documented anxiety scores, measured outcomes. The results showed significant reductions in anxiety and depression. But the researchers went further. They measured blood levels of BDNF, the protein your brain uses to grow new neural connections and repair damage that chronic anxiety causes over time. In patients taking Nigella sativa, BDNF levels rose measurably. Think about what that means. The ancient physicians who buried these seeds with a pharaoh, who described them as restoring vitality and pulling people back from despair, were not imagining it. The seed was not masking symptoms. Research suggests it was helping the brain physically rebuild itself. 14 centuries after Ibn Sina documented it, a peer-reviewed study confirmed the mechanism. Then, in 2025, researchers published results from a randomized, double-blind clinical trial, the strictest standard of evidence modern medicine recognizes, on Aframomum melegueta. Participants taking a standardized extract reported measurable reductions in anxiety and tension within just 48 hours. The researchers identified exactly why. The seed's compounds were protecting the brain's natural calm chemical from being destroyed. 3,000 years of West African traditional use vindicated in a single trial. Both studies are sitting in public scientific databases right now. Anyone can read them. Your doctor almost certainly hasn't. Not because the research is hidden, but because research without a pharmaceutical company pushing it into clinical guidelines simply does not travel. Science caught up with the ancient healers. The system responded with silence. Let's put some numbers on the table. The global pharmaceutical anxiety and depression market, $500 billion annually. Not supplements, prescription drugs, patented, controlled, priced at whatever the market will bear. In 2022, the pharmaceutical industry spent over $370 million lobbying the US federal government. More than oil, more than defense, more than any other industry in the country. What they bought? Favorable approvals, extended patents, regulatory frameworks designed to keep alternatives off prescription pads.
And when the lobbying is done, the executives rotate. Drug company leaders move into FDA advisory roles. FDA officials leave for pharmaceutical boardrooms. Legal. Documented. Routine. The name for this is regulatory capture. The effect is simple. The system approves what can be owned. It ignores what cannot. Nigella sativa cannot write a lobbying check. Ziziphus jujuba has no government affairs department. Aframomum melegueta has never funded an FDA dinner. So they stay on supplement shelves. Their research stays unread. Their names stay off prescription pads. The system is not broken. It is working exactly as designed. Just not for you. Here is what might surprise you after everything you just heard. These seeds are not illegal. Not one of them. Black seed oil is on shelves right now. Jujube seed extract, grains of paradise. No prescription, no legal risk. You can buy all three today. They just cannot tell you what they do. Federal law prohibits any manufacturer from stating that black seed reduces anxiety, that jujube seed has treated it for 2,000 years, that a 2025 clinical trial confirmed exactly how grains of paradise protect your brain's calm chemistry. Say any of that on a label, and you need FDA drug approval. Approval that costs hundreds of millions. Approval nobody will fund for a seed they cannot patent. So instead, the label says, traditional herbal supplement, not intended to diagnose, treat, cure, or prevent any disease. 3,000 years of documented use, hidden behind a disclaimer. In Australia, a licensed practitioner can prescribe Ziziphus jujuba for anxiety because their regulator evaluated the evidence and approved it. In China, a patient describes their symptoms and walks out with a Swan-Zhao Ren formula because that system never required a patent before accepting proof. In America, the same patient leaves with a benzodiazepine. The seeds are here. The research is here. The access exists, technically, quietly, stripped of every word that would make it useful. Not banned, just invisible. And in medicine, invisible and banned produce exactly the same result. If you have watched this far, you are not someone who accepts a prescription without asking what it does.
You already knew something was missing from the conversation about anxiety. That 40 million people suffering, 92 million prescriptions, and 12,000 deaths a year could not possibly be the best medicine had to offer. Now you know what was buried. These three seeds are not waiting for FDA approval. They have been waiting for 3,000 years, in soil, in herb shops, in ancient medical texts, for the moment when enough people understood what was being kept from them. That moment is now. Research these seeds. The studies are publicly available on the NIH's own database, free, for anyone willing to look. If you or someone you love is trapped on medication that is creating more problems than it solves, bring these names to an integrative physician, a naturopath, or a traditional medicine practitioner trained to understand them. You deserve options. You were always supposed to have them. Share this video, not for the algorithm, because you almost certainly know someone who is suffering. Someone handed the same limited menu and told it was the full picture. Sharing this is not a small act. The system depends on one thing above everything else: your silence. It depends on this research staying inside journals patients never read, on these seeds remaining invisible behind labels that cannot speak. Every person you tell is one less person kept in the dark. The ancient Egyptians believed these seeds were powerful enough to carry a king into the afterlife. Ibn Sina believed they could restore a mind broken by despair. 2,000 years of Chinese physicians believed the same. They were not wrong. The only question now is whether enough people find out in time. If this is the kind of research you want more of, subscribe to Ancient Healing Harvest Secrets and hit the bell. This is a hidden library. Ancient plant wisdom, practical backyard knowledge, the seeds, roots, and remedies that fed and healed families for centuries before the system decided they were inconvenient. Every week, one forgotten plant, one recovered truth. This knowledge survived because people passed it on. That bell is how you keep it moving. Subscribe, hit the bell, share this with one person who needs it. The library is open. Come inside.